Hello and welcome. Harvey Olivio, Carrington College Clinical Instructor. I have the respiratory guy, Mr. Houston, with me on the video camera.
Greetings, everyone.
We are going to do our competency for patient positioning. So we're going to start like we do with everything else. We want to identify that we have an order for this. We want to check the patient's chart. I'm going to come in and introduce myself. Hi, Mr. Johnson. My name's Harvey. I'm with Respiratory. Going to do some positioning with you, different patient positioning. As long as the patient's okay with everything, we can go ahead and get started. I'm going to also make sure that I have proper PPE on, so whatever I need to enter the room, I'm going to make sure I have it on. Okay. One of the most important things about doing this is safety for your back. So you want to make sure you're adjusting the bed to the proper height. You want to make sure that the patient's involved as much as they can so that they can assist you too. Also, when you're doing any kind of lifting, you want to bend with your legs and keep your back straight. Okay, you want to make sure you have good alignment as well. Use all your major muscle groups, and you want to use a wide base of support. If you're going to move the patient, and let's say I wanted to put the patient's head down and kind of boost them up that way, you'd want to use the bed to help you too. So we could raise the legs, kind of put them at an incline, and that will help us scoot the patient. When possible, it's also a good idea to sometimes have a partner or some help so that two people can help the patient move. So you want to make sure whatever rails you put down for safety that you just put them back. Make sure your bed is appropriate. So we're going to start off in a position that's very common in the hospital. This is semi-Fowler. Typically, some of the beds do have degrees, and they will have a degree measurement on the bed rail, so you'll know exactly what degree you're at. So this one we would pretend was at 30 degrees exactly. There is a chart that we can refer to. I'm going to go ahead and show you that real quick, but we are not going to do all the positions because we have some time restraints. So I'm going to go ahead and start with semi-Fowler. So this is our semi-Fowler position. If we were to do high Fowler, make sure that everything you do, the patient's okay with it, because some patients have back injuries or have some issues where something hurts. So just be mindful of anything that the patient can or can't do. So Mr. Johnson, I'm going to go ahead and raise the bed a little bit. So this would be our considered high Fowler position. Okay, so that's about a 40 to 60 degree angle, or 30 to 45 degree angle. Okay, for the semi-Fowler. When we go to high Fowler, it's going to be 60 to 90. Now, the other position that we're going to do, so that I can demonstrate for you, I'm going to go ahead and lay the bed back down. So anytime we go to move the patient, we would also ask them if they're okay with their breathing, make sure that they can tolerate being flat. I'm going to go ahead and lower this rail so that I can access the patient a little easier. And I'm going to go ahead and put him on his side, so I'm going to go ahead and bring him this way. So I would ask him for help if he could help me. If he could not, then I would do it myself. So you want to go ahead and just move the patient, okay? And he is kind of heavy, so you would come on the side. Also, there may be times where you need to put a pillow between his legs and kind of support him. So you can go on your side. I'm going to go ahead and put him back so that we can try a different position. Okay. Now that I tried him on that side, I'm going to go ahead and do Trendelenburg. The Trendelenburg would be with the head down, the legs up. Reverse Trendelenburg would be with the bed opposite direction. We would have the head up, the feet down. And then you can also do prone. So prone is a very popular position for patients to help with their lungs, and it helps aerate different sections of the lungs. So to go prone, I'm not going to do it on this demonstration, but we will show you what it looks like. But I would turn the patient over, and then a lot of times we want to cushion the chest with something. So sometimes I would put some pillows on the chest to kind of raise the head a little bit so that we're just not kind of flat. And then that way the patient can breathe and move his head a little bit and be more comfortable in the prone position. So after we're done with all the different positions that we want to do, we want to make sure that any types of movements we did with the rails, we put them back. We want to make sure we put the bed back at a proper height of what it was before we did anything. And then we want to put the call light in the patient's hand and make sure that he knows how to operate it. We want to make sure that we identify any kind of code switches or nursing call lights that the patient might need to activate. And then we also want to ask the patient if there's anything else they would like or need. And then when we're done, we're going to document everything we did and check the room for any types of hazards that might be left to make sure that everything's safe. Thank you and have a wonderful day.